According to the WHO, 15 million babies are born prematurely every year across the globe. And sadly, India tops the premature birth rate. In India, out of 27 million babies born every year, 3.5 million babies are born premature. As you're aware, preterm birth is associated with neonatal mortality and morbidity. In addition, it may cause disability in later life. The frequent complications of preterm birth are neonatal sepsis, which contributes to 19% of all neonatal deaths in India, MRSA and nosocomial infections, which contributes to 40% of all neonatal deaths in developing countries, and necrotizing enterocolitis, with a mortality rate of more than 50% in infants who weigh less than 1,500 grams. Treatment for these devastating infections lead to expensive hospital care from supportive therapy like thermoneutral environmental provisions, IV fluid or inotrope administration, mechanical ventilation, and broad-spectrum antibiotics, which can cause many side effects. Is there a way to prevent these complications in preterm babies? Yes. Bacteriotherapy is a promising option to prevent these complications. Recent evidence shows a strong role of probiotics in preventing various complications in preterm, low birth weight babies. In order to rescue preterm babies from life-threatening complications, Tablets India, in technical collaboration with Morinaga, Japan, introduces for the first time in India Rescunate sachets. Rescunate sachets contain 1 billion CFU of Bifidobacterium brevi M16V, the most documented probiotic strain in preterm babies to prevent various infectious complications. Rescunate is useful in the prevention of late-onset neonatal sepsis, MRSA and nosocomial infections, and necrotizing enterocolitis. Bifidobacterium brevi M16V has got a higher colonizing capability in the intestinal tract of neonates. Internationally, it was found that Bifidobacterium brevi M16V has been used to improve the colonization of the gut with good bacteria and boost immunity, which in turn prevents pathogenic invasions. Bifidobacterium brevi M16V exerts the following actions: competitive exclusion of pathogenic organisms from the gut, formation of normal intestinal microflora, restoration of bifidobacterial count to normal levels, strengthens the gastrointestinal mucosal layer, boosts the immune system, and modulates immune response by acting on T helper cells and immunoglobulins. Studies published by Pediatric International and PLOS1 indicate that early administration of Rescunate promotes effective colonization of Bifidobacterium and formation of normal flora in the intestine of premature infants. As a result, intestinal binding sites are occupied by Bifidobacterium and pathogenic organisms are excluded by competitive inhibition. A study published in the Journal of Japan Society of Perinatal and Neonatal Medicine concluded that Rescunate is effective in preventing neonatal sepsis. This resulted in nil mortality in the Rescunate group as compared to the control group, where mortality was 5.6%. Studies published in the International Journal of Probiotics and Prebiotics and Acta Neonatologica Japanica concluded that administration of Rescunate is very effective in preventing nosocomial infections in premature low birth weight infants. Reduction in mortality is one of the positive outcomes of these studies. Improvement in enteral alimentation and body weight has also been seen as a result of Rescunate administration, along with reduction in the mean duration of hospitalization. In the case of MRSA, methicillin-resistant Staphylococcus aureus infections, a study published by Acta Neonatologica Japan demonstrated that administration of Rescunate resulted in significant reduction in MRSA infection rate, from 15% in the placebo group to 8.8% in the Rescunate group. Studies published in PLOS1, International Journal of Probiotics and Prebiotics, and Journal of Japan Society of Perinatal and Neonatal Medicine prove administration of Rescunate is very effective in preventing necrotizing enterocolitis in premature low birth weight infants with significant reduction in mortality. Findings in numerous clinical studies show that Rescunate effectively prevents late-onset neonatal sepsis, MRSA-associated nosocomial infections in premature low birth weight infants, and necrotizing enterocolitis. The safety of Bifidobacterium brevi M16V has been confirmed by oral toxicity tests, analysis of antibiotic resistance, genomic analysis, and numerous clinical studies which have found no adverse effects among the study subjects. Bifidobacterium brevi M16V has been granted the generally recognized as safe status by the US FDA. The dosage for Rescunate sachet in preterm babies is 1 sachet twice a day till the completion of 37 weeks. In-term babies require 1 sachet twice a day for 14 days. The contents of the sachet can be mixed either with 3 ml of mother's milk, boiled or cooled portable water, or sterile water and administered to the baby. Rescue every neonate. Rescunate.